So last I checked, there was an election, and depending upon you ask, there are results. Not everyone agrees on the results, but we do think that going forward, maybe more so than others, between the pandemic and the election, life is changing, and I think it's this is really a good time to get some perspective from two folks who are knowledgeable about politics and where we are going. So I want to introduce Tonya Kinlow, who leads government affairs at Children's National, and Dr. Lee Beers, who is a practicing primary care pediatrician, still a bit, uh, and much to our pleasure, and the incoming president-elect of the American Academy of Pediatrics, and a really extraordinary moment to sort of take over the reins. So Tonya and Lee, give us some perspective.
So thank you, Mark. Just want to make sure you guys can hear me. I see the slides, so I'm assuming that the slides are running properly. I have a little bit of technical difficulty with stuff like this. I don't know why. Just as Mark said, we did have an election, and it has been, at least for me, as a political scientist, some of the most interesting stuff that I've seen in terms of electoral politics and electoral processes, things that I hadn't even really thought about as the undercurrent of how we actually bring leaders to office in this country. I think the way that Lee and I decided to divide this, I'm going to talk more of the process and the technical aspects of what we've seen, give a little bit of high level on the policy, and then tee it off to Lee to get to the nitty gritty on the policies and the politics as it relates to pediatric practices. And so Lee, if you could go to the next slide for me. I wanted to just introduce a little bit about the Child Health Advocacy Institute. As Mark mentioned, I am the Vice President for Government and Community Engagement here at Children's National. Within that office is the Child Health Advocacy Institute, which through leadership and collaboration seeks to advance policy and systems change to achieve health equity for all children. It is a focus of our work and very important to what we do, and very representative of Children's National as a thought leader in pediatric healthcare, both nationally and locally. Lee, next slide. So the way that I look at this 2020 election is, we're just a divided country. We are almost equally split from what I would categorize as progressive or conservative. But for me, and the work that I do, divided government gives me and my team an opportunity to apply an effective strategy and to achieve the goals that we want to achieve in terms of our healthcare policy goals. Next slide. So we looked at this election, and what was most interesting was the number of people who actually showed up to vote in this election. When you look at it by percentage, it is the highest voter turnout since the 1900s. And so that creates kind of a unique view of like where the country is. I think that both parties really focused hard on bringing out their voters, and it seemed to work because you had very, very high turnout. Next slide, please. Just looking a little bit at the presidential results and going back to my original point about the the divided country, and you look at the geography of where the votes are coming from, and you see that typically the Republicans are winning in kind of more rural type in the middle of the country voters, and the Democrats have a pretty solid stronghold on the West with the Northeast and trending a little bit westward with the Midwest, and Biden having some success there. When you look at the Electoral College breakdown, Biden looks like he has a solid majority, something that aligns with a mandate. But when you get under the hood of these numbers, it's really a very soft election, and not a very clear direction in terms of what the people who voted for him are really expecting, especially if he leads as he says he wants to lead, as the leader of the entire country. Next slide, please. When I looked at what the president-elect is doing right now, and that he is now moving forward, even though, as Dr. Weissman said, there are some questions about whether he really won, if you ask some people. He's moving forward with his transition planning. He is gearing up to appoint a new Secretary of Health and Human Services and the other leaders within HHS. He's got some top candidates that I'm very interested in. Governor Michelle Grisham from New Mexico, maybe Dr. Vivek Murthy from the former U.S. Surgeon General, and possibly Congresswoman Karen Bass, who is sitting Congresswoman from California, a practicing physician assistant, someone that I've worked with closely and is in contention. I think that it's interesting to think about the people he's talking about putting in there, because from the way that we get our work done is in developing those relationships. If he chooses someone that we already have a relationship with, that is a very important thing for us. The president-elect also has established a task force, and I think Lee might talk about that in a little bit more detail, so I won't go into it. But I do want to talk about what he is thinking about in terms of COVID supplemental. And although he doesn't have a lot of influence over that right now, I know he wants to see a new package revealed right now, wants to get more money out for families who are struggling, the unemployed, funding to state and local government so that they can get schools up and running, and also so that they can be prepared when we roll out this vaccine to be able to do that. And I think he recognizes that without that support, it's going to be very difficult for him to be able to hit the ground running. And so he's looking forward to some action from Congress there. And then we believe, will be a lot of work done on reversing some of the Trump administrative executive orders, in healthcare, in immigration, and on racial justice issues. Next slide. So now I want to talk a little bit about what's happened in the Congress, because it takes both parts, the executive branch and the legislative branch, for us to get our work done. In the Senate, very interesting. Would never have guessed in my entire life that we might see a possibility where the Vice President of the United States of America actually gets to exercise the very special power, the most important power that they rarely get to use, and breaking a tie vote in the Senate. But the possibility does exist. Right now, you see the state of Georgia is still gray. That's because they had two Senate elections, and in neither was a candidate able to achieve 50%. And as a result, there are two runoff elections. You see, the Republicans already have 50. They only need one more for the majority. Right now, this shows that the Dems have 46, but when you count the two independents who vote with the Democrat caucus, they're at 48. If the Dems can win the two seats, still undecided in Georgia, it's a 50-50 split. That is very interesting and exciting. I will tell you, I'm not expecting that to happen. I hate to be the naysayer to the Democrat Party push to turn Georgia completely blue, but I think it will be an uphill battle. These seats will have so much money, so much attention, because for each party, it is a pivotal decision that the Georgia residents are making. And I definitely wouldn't want to live there now, because this is all they're going to be hearing about between now and January 5th, when the election takes place. For Children's National, I would say in the Senate, we're probably going to be working with those leaders the same way we've worked with them in the past, because we're not anticipating a lot of change in the makeup of that body. Next slide, please. Now, House of Representatives. Think about the fact that in the last election, the Democrats picked up a large number of seats. And I think going into 2020, they thought that they would grow that majority significantly. That did not happen. In fact, if like when all the votes are finally counted, because there are still some seats that have not yet been decided, when all of the votes are kind of finally counted, the Dems and Speaker Pelosi might have the slimmest of majorities, but a majority nevertheless. And so the Democrat Party will, in fact, continue to run the House of Representatives. And again, with that, I think that it allows us to have a little bit of leverage in using the relationships that we've already existed. And that will help us to advance our policy objectives. If you could go to the next slide for me, and then the next one. So I talked a lot about kind of the makeup of the two bodies. And I also talked a lot about the fact that when we are working with members of Congress, we actually have to work across the aisles. We take a very bipartisan approach to how we get our work done. And when we do that, I think that helps us to achieve our goals. What we're seeing for for the 2021 legislative year, we've got some pretty solid policy priorities that we've already established. We want to see additional supplemental appropriations. We want to see additional federal appropriations for some of the work that we are invested in. The children's graduate medical education is always a top policy priority for us. One of the really positive things that I think comes out of a Biden victory, I will say 4 years ago, we were having to fight just to defend what I consider to be basic health insurance programs like the Medicaid program, and whether it would continue to be an entitlement for all children who need it. The Republicans were really pushing to turn that program into a block grant. And, so we were having to use energy just to defend existing programs. I think in a new Biden administration, with the House in control, we'll have an opportunity to push for some new ideas for some new big programs and for additional investments in maybe children's graduate medical education, strengthening of the Medicaid programs, protecting and ensuring the continuation of the Affordable Care Act. So I think that having a Biden administration is important to us. The other thing, and I heard you guys talking about this when I signed on the issue of telemedicine, we believe that it is the way that we will continue to provide healthcare access, that there is great interest from patient population to be able to have it. And I heard someone say, yeah, but we need to be able to get reimbursed for it. And so that is typically a local issue that we're going to look at, but we will also be working this issue at the federal level and believe that there will be some success there. And then there's the rest of this list of issues that we will be working on around surprise billing and transparency, and whether or not the Biden administration will stick with the rules that the Trump administration put in place. We're going to be looking at all of the rules that came out during the Trump era to see where we might want to effect some change. And in this transition process, push to see them make those changes. I think that because we will have a divided Congress, a divided government, you will likely see that the Senate with the McConnell will not want to advance the Biden agenda, and you will see the House really trying to stick with him. So he will probably do a lot of stuff through executive order and rulemaking. Seems to be a pattern that we will have to follow very closely, that we will need to make sure that we are very abreast of and understanding how we achieve our policy objectives. And so I'm going to stop there so that Lee has a little bit of time to talk, and we can maybe answer a few questions.
Oh, great, Tonya, thank you. And don't worry, I'm a fast talker, so we'll get through. It's actually a great lead into some of the things I'll be talking about today. And as Tonya said, really focusing in on specifics around the AP's priorities for child health as we move forward for the remainder of the year and 2021 and ahead. So I think I'm going to emphasize one of the same things that Tonya emphasized, is that as an AAP, we are a nonprofit, nonpartisan organization. And that means that our agenda really is for children. We many years ago, one of our leaders said that we are nonpartisan, but we are unabashedly pro-child health. And that's really where we try to maintain our focus. Before the election, actually, we published a blueprint for children, which lays out a really comprehensive child health policy agenda for the year ahead and beyond. This is something that we actually do every 4 years. And similar to the 2016 election, we really have laid this out into 4 different categories of things that we are really thinking about and focusing on. And that's healthy children, secure families, strong communities, and becoming or maintaining our status as a leading nation for youth. And I'm going to dive into some of that a little bit, but I just want to, there's quite a bit in the blueprint, and I encourage you to go to our website and take a peek at it. But I just want to pull out some of the things that really, I think for us as a board and as an organization are coming to the top as areas where we think we're going to be putting a pretty significant amount of effort and focus over the coming year. One of our highest priorities, of course, and I think you all heard Dr. Hart talk about this earlier this morning, is a really strong focus on financial relief for pediatricians. We know that pediatric practices are struggling and hurting, and that the return of volume to practices has not been as swift as we would hope and want, and not as robust as in other specialties. And there are a host of other challenges that our pediatric practices face, and we will continue that fight, and we will continue to work with our pediatricians, because healthy pediatric practices make for healthy children. I will echo Dr. Fox's emphasis on telemedicine, that is a part of that. And we will continue to really focus on that as an important strategy for access, but also making sure that we protect the medical home as we support and promote telemedicine. We will be focusing in as well on really continuing to strengthen the immunization delivery system for children, and in particular issues of access and payment, focus on Medicaid and CHIP. Funding for schools. We know you all heard the other Dr. Beers talk a little earlier about the back to school considerations for children, and part of that is funding for schools to be able to implement the measures that they need to measure, and that will be an area of focus for us. Mental health, I know in our practices are seeing children and families with tremendous struggles with mental and behavioral health, and we need to figure out better ways to address that. We were already working with systems that inadequately addressed the mental health concerns of our families, and that it's only been exacerbated. And so that will be a huge area of focus for us in the coming year. We will continue our focus on health equity, which is a core value for us, and an area of significant focus over the coming year, with a detailed one-year equity action plan for our organization. We also will be focusing on issues related to nutrition and WIC, as well as continuing our strong support for immigrant families. There's a couple things, as Tonya mentioned, when we looked at 2021, there's some considerations in the post-election time, but also thinking about what can we accomplish over the coming months during this period of time that is colloquially called the lame duck period of time. There are a couple of very specific areas that we really hope to focus in on, including the trying to help encourage further passage of a COVID relief package, thinking about what the appropriations are for FY21 and the National Defense Authorization Act. There's some interesting and promising bipartisan work happening in maternal health that we will continue to work on, as well as an extenders package. So, and I think, Tonya made a really good point that we can really get very effective work done in a bipartisan way. And there are lots of things that really are bipartisan, that we can and will continue to push forward behind the scenes. And so then when we move to the new administration, the period of new administration, we have, as a supplement to the Blueprint for Children, also published a transition plan. Again, this is something that we do with every new administration, that really focuses on some very specific recommendations for advancing child health in a Biden-Harris administration. This is just a little bit of a preview of that, and again, it's online and publicly available, so please feel free to go and look at that a little bit more carefully. But we break down in those 4 areas: healthy children, secure families, strong communities, and leading nation. We break down some very specific recommendations in each of those areas with 140 plus recommendations and 27 issues areas. So it's a very comprehensive document. Tonya did mention the COVID-19 Advisory Board. The really key thing I want to point out here is that Drs. David Kessler and Julia Morita are both pediatricians and are incredibly accomplished, and we believe and think will really represent child health on this transition board. And so it's, we think, a really important thing that we're there. This is not election related, but it is another sort of important thing that has been on all of our radar during this period of time. Actually, I guess now 2 weeks ago, there were oral arguments in the Supreme Court in the California versus Texas case, which was looking at some elements of the Affordable Care Act. This is something that we were all watching very carefully, particularly with the new Supreme Court makeup. The AAP did join the AMA and other physician groups in filing an amicus brief. And through listening to the oral arguments, I will admit I did not listen to them myself, though our CEO, who is a lawyer and loves this sort of thing, did actually listen to the whole oral arguments. And the general consensus is that which Mark agrees with, is that the justices don't seem inclined to fully overturn the ACA, even if a majority of them do rule the individual mandate unconstitutional. It's unclear when that decision will come out, but it could be as long as 6 months. And so as I close, just want to share with you a few resources that may be helpful to you in your own child health advocacy work. This is probably how we are all feeling right now, no matter where you sit on the political spectrum. It has been a tense and, as Tonya said, divided time. And I think what we know about the research into both anxiety and burnout is that a sense of control and taking action on the things you can control really does help with that anxiety. So with that frame, I want to share with you a few advocacy things that you can do to help advance child health. I want to let you know there are a few advocacy resources. We are regularly publishing a federal and state advocacy report with quite a bit of detail on the COVID-19 response and other related issues. That's on our website. If you have not already, please sign up for our Capital Checkup listserv. And that gives you regular, but not too regular, it's usually about once every week or two, emails around what's happening on advocacy and child health. And then we have scheduled our legislative conference for April, which will be virtual. We've already done a number of virtual Hill visits and they've gone very well. And so this coming legislative conference will be virtual, and we really encourage you to sign up for that. That's a wonderful conference that teaches skills and sort of background information on how to be an effective advocate for child health. On our website also, there are some additional advocacy resources for individual chapters. And I think while these are targeted towards state chapters, other groups and individuals also may find them helpful as well. And so there's a number of different sort of template letters and other kits. I think Dr. Hart mentioned this earlier too, that you can pull up that can be helpful in terms of advocating for adequate payment and other important supports. The AAP Blueprint for Children, if you liked what you see and would like to have a more tailored version for your individual's jurisdiction, you can pull that up actually as well on our advocacy website. And then again, these are tools that are designed for state chapters, but I think are actually very applicable to other individuals or groups who might be interested in doing more in terms of a more structured advocacy activities. Hill Days, just doing individual advocacy, you can learn from this as well. So there's a new Chapter Advocacy Day planning guide on the website that has a lot of great information in it, even if you're not planning a full-blown Chapter Advocacy Day. And then as an individual, if you aren't already a member of the AAP and you are eligible, I would be remiss if I did not encourage you to do so. The links to at least the most closely local chapters are here at the bottom of the page. Please consider joining National AAP and your local chapter. If you are already a chapter member, consider joining a council committee or section so you can dive deeper into the things that interest you. And if you have already done that, consider taking on a leadership role. If you go to the website under volunteer opportunities, there's actually a very detailed website about different leadership opportunities that are available. And we really welcome your involvement. I think we have a lot to fight for in child health, and it's going to take all of us. And so I really just encourage you to join us if you have not already. And we welcome your involvement as child health advocates. And with that, Taylor, I saw you pop back on. I figured that was our cue.
Thanks, Lee, and thanks, Tonya, for providing that framework. I do think it's helpful sort of getting the national perspective. These are unprecedented times, and they call for us actually to get involved. And that was part of our reason for providing some space and inviting our local chapters to provide updates at the beginning of the session. So it's sort of a good bookend, but I would recognize that not all change happens with a national election. Actually, much of the change really is happening locally at the state level, which is why we want to be sure that we're engaged in working with our leaders, and our leaders are us. At Maryland, DC, and Virginia. And we've been doing great work, and it's just a time to sort of keep it up. So we have had a really busy morning. I want to thank so many of you for A, participating, and B, still being with us and hanging online. And I just have one or two things to sort of say in parting. I want to remind folks that on December 1st, we're doing a town hall. We'll make the links available and push them out. But, you know, in terms of clinical, we've focused a lot on the business of pediatrics and policy and reimbursement and those sorts of things. But in terms of just the pandemic and where we are going clinically, Bud Wiederman and others will be bringing you up to speed on December 1st. We want to thank our planning team. It's not just the folks here who actually helped put on today's show, but actually all the input that we get from you, our community practices and office managers and pediatricians. We reach out to you, you give us ideas, we try to turn it around, and we are a wonderful community of pediatricians and pediatric practices. Sharing an interest in helping kids and families in our community. It's pretty unique, it's pretty extraordinary, it's pretty wonderful. We are here to try to help gather and share information and help all of us be successful. We will be doing a Future of Pediatrics in June 2021. I don't know if we're going to be back at in a meeting hall or whether this will still be some sort of virtual event. That remains to be seen. We welcome your input. We welcome your suggestions. There have been a number of great comments and questions, so look for some resources coming from the Pediatric Health Network. We will be pushing back information to you all with links for additional information. The changes coming in E&M codes for 2021, that's still a bit of a work in progress. We'll shoot out information about the extended coaching webinar that's coming from Chip and Jan and folks. We invite your questions. We don't have all the answers, but our job in part is convening and identifying resources and helping find the answers for you. And pediatrichealthnetwork.org is where hopefully these things will be up in a day or two in terms of the presentations and other resources. So I want to thank all of our presenters, and I want to thank, just as importantly, all of our attendees, our pediatricians, nurse practitioners, office managers, other key staff, for really being champions for kids and for pediatricians and helping us make the world a better place, because Lord knows we need that these days. Thanks, everybody.